Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We understand and appreciate how valuable everyone's time is, and that's why we try to make each episode here at All Home Care Matters something that matters to you. Today, we are honored and privileged to welcome a very special guest, the co-founder of AlayaCare, Neil Grunberg. Welcome, Neil.
Thank you. Great privilege to be here.
So, Neil, what is AlayaCare?
AlayaCare is a software application, software platform to help home care agencies and home health agencies not just take care of the people they're responsible for, but help foster that through innovation and through incorporating and creating value for all stakeholders, your care workers, staff in the back office, everyone and anyone that comes in contact. We really consider part of our goal to create better outcomes for.
Sure. So being the co-founder of AlayaCare, you must have identified a need for this type of service. What was the need that you identified, or how did it come to be?
So prior to AlayaCare, Adrian and myself, and actually Brady, the three co-founders, we had a mobile workforce management application company, and we partnered with a lot of organizations in a lot of industries. We recognized that home care was an emerging market. It was in a market that we played in. We also identified that mobility and user experience and things like machine learning that we'll talk about later, I'm sure, really were not yet well adopted in the market. And it was something that we could bring, which was something really interesting to us. And then it also, the other big thing that we identified is that it mattered a lot to us. We all hit a time in our lives where if you asked me in my 20s or early 30s, I might not have noticed how important home care was. Same with Brady, same with Adrian. As we sort of reached our mid 30s, late 30s, we realized, wait a second, like this grandparent, this parent, I watched my mother-in-law dealing with her father going from a titan of industry in Toronto to at-home care for dementia and the struggles and the stress on her running to and from. And the very specific story that I always think about that was one of my so what moments was she would constantly be running back and forth. And I'd ask her, you go 3 times a day. It seems like you're an amazing daughter. And she's like, yeah, I can't read the handwriting of the home health aides in between their shifts. So I need to ask them what happened because I have no way of knowing how things work. So it's paper charts. I'm like, oh my gosh, paper charts, this lack of communication, lack of efficiency. So we just felt that we wanted to build an enterprise software application. And we just felt for every reason possible, this was the right market for us to do it in because it mattered to us that the areas that we knew really well, we could apply, and it worked. It's been a beautiful journey thus far.
That's great. So what's your typical clients? What type of clients do you typically serve?
It's interesting. We're in a lot. One of the advantages of AlayaCare is a great flexibility in our product. And that's afforded us the opportunity to play in different markets. We've got franchise, public sector, single ownership structure, anywhere from 80 care workers to 27,000 care workers. In Australia, Canada, and most definitely the US. Private pay, Medicaid, a pretty big infusion therapy, a pretty big mix because the platform was really built with the technology approach to grow it, make it very extensible. There's a big partner network that sits on top of it. And that all is part and parcel to, it's almost difficult for us to define our one perfect client. Sure. The effort is to create all of our clients have a perfect experience. Now, with that being said, the flexibility is our greatest strength. it looks to organizations that want to innovate. It looks to organizations. Our perfect client is one that wants to adapt their workflows and figure out what the best workflows are over time, not just replace like a paper version of their system. We used to call that, like, clients early on would call, like, electrifying their workflows. Let's putting like a web form where a paper form isn't doing a lot. There's a lot more that you need to do on top of that.
Sure. So what would you say is the one contributing thing that sets AlayaCare apart from, I'm assuming you have competitors. What would you say is the one thing that sets you apart from them?
It's a fantastic question. I would like to list 100 things, and I have actually a tremendous amount of respect for all of our competitors. So it's not
list as many as you'd like.
No, I think one of the things that we really, it all sort of ties together, but our user experience, and user experience is not just a screen, and it's not just where the buttons are, but it's sitting in the persona of the client and of the care coordinator, of the care worker, of the finance manager, everyone and anyone in the organization, and trying to figure out how to make their job the most efficient so they can focus on the important instead of the urgent. And that focus, the only way that you can accomplish that is by really listening to I talk a lot, but I try to listen to our customers, and everyone in our organization has that same mentality where we try to listen to the customers as much. And we have customer advisory boards and user conferences and go to conferences. And when we're at conferences, we don't sit. There's no chairs in AlayaCare. Hopefully there'll be conferences again at some point, right. But we don't put chairs from the very beginning. We went to our first ever conference in like month 2 of AlayaCare, and one of our co-founders, Brady, VP of sales, he had just run his first marathon. And we got there, and I had said, by the way, like, we're doing no chairs. And he's like, yep. And he stood for 2 days after just running a marathon and then flying 4 hours. Like that kind of, what that means by not sitting at a conference is you're standing, even if it's not your customer, you're not stopping to take every opportunity you can to learn from the people in the industry who are sitting there in the trenches day in, day out.
Right. So what would be some examples of the innovative features that AlayaCare offers?
There's a number which I'll go through. One is definitely, I already mentioned, the user experience and the design approach. Everything from the way we're doing EVB to our mobile app in the field. We take it all extremely seriously and try to innovate on design. So when we came into market more than half a decade ago, I think we had a tremendous UX, but we've continuously evolved it so that we're not sitting with 6-year-old user experiences. We're evolving it. We're relaunching our mobile app. We went with the premise on mobility 6 or 7 years ago that for many users, this might be their first smartphone application they're using. So it better be simple, it better be clear, and it better be crisp. Right. So mobility is huge. User experience is huge. Virtual care is a big one. We always had virtual care, but last year around this time, we pivoted really quickly for our clients and threw some really important features: contact tracing, virtual care, mandatory screeners. That agility, that's sort of, it's hard to define that as an innovative feature. It's an innovative approach to a company that we were able to get those 3 incredibly important features out to market in a matter of weeks. We started developing contact tracing before the term contact tracing was even defined. Originally, it was called the Kevin Bacon report internally. So it was the 6 degrees of separation, right, who a care worker has been to and who they have seen, et cetera, et cetera. So I think virtual care. And then the last sort of big area on top of Family Portal, our partner ecosystem, Alaya Market that's coming to market. But the last really big one is our approach to data science and data in general. We've got one of our earliest sort of co-founder group members is running now a data team as a direct management structure, because we value the data so well. So benchmarking, being able to drive real value for clients. And then in addition, a couple of years back, we added a department around machine learning and data science. So we're taking data very seriously, both data that you can pull out and see in a report, and then data that you need to apply machine learning or data science, look at things like employee churn risk or employee satisfaction risk, not from, just polling the employees, but looking to see lates and refusals to take a shift and calling an absent, and even just looking at how they're corresponding with the office. There's triggers and words you can look for, and that can trigger your availability versus your visit. So all sorts of things that you can look at to really drive and say, wait a second, if we know in this industry staffing is the biggest challenge, how could we nip it in the bud by trying to identify the 5 or 10 next employees that might be looking elsewhere because they're not getting enough hours, or they're not getting the hours they want, or they're not happy with something, and address it so organizations can address it. Similarly, looking at if in the in the private pay world, or in any area, but a rehospitalization has a huge heavy burden to it. So if you can just pick out notes, we can't expect every health aide to be a data scientist where they're looking through the trends of all the visits that we're asking them to take care of someone. So if we can look through all the notes and all the data from the visits and pull out really valuable insights and say, based off of this, we see a trend that this client might be on their way back into a hospital, that's massive. And it's really important.
Oh, it's tremendous. Well, and I think not only for the company and the staff, but probably for the family as well.
Absolutely.
What would you say are some of the benefits that AlayaCare offers on the family side?
So we have Family Portal is a huge value proposition. We've launched it. We, again, talking about first generation, second generation within AlayaCare, we're constantly iterating. We launched even a newer and improved version of our Family Portal. I think it would have been in 2020. It was a bit of a foggy year at this point.
Sure.
And in doing so, it gave a lot of opportunity for the family members to get visibility, clarity, and control over the care without creating additional burden, but actually reducing the burden of the care coordinators, schedulers, back office staff, who really are probably like the unsung heroes in this industry. If you it's pretty eye-opening. We get every new employee, not this last year, we get every new employee to go visit a client and just stand in the office for a half an hour. And you're like, if you think this is what an air traffic controller's stand looks like, air traffic control is a lot calmer than this. Right. It's a little bit easier. So we recognize how tough their job is. We built the Family Portal thinking of them. So thinking of the family member, but thinking who's on the other side of that, who's on the other side of those requests, who's on the other side of that information pull. So we really keep that in mind every step of the way. And I think that was a big thing.
And I think I just want to say too, being in the home care industry, how impressive it is that AlayaCare and your team was so responsive so early on at the initial outstart of the pandemic, getting that contact tracing going, getting probably the pre-screening questions and things like that. I think you guys were a little ahead of the curve, which I think speaks volumes to where you're, headed towards, making sure it's about care first and the staff and the families. That's a tremendous aspect that I think you guys should be very proud of. That was something we are right away,
We really view, and it really goes to two things. I mean, it speaks to two real great strengths. One is an engineering team that's second to none. The data science team helped out, even though it wasn't like a total data science project on contact tracing. But then the other part is the listening to customers. So despite the fact that we were in the middle of a pandemic, we have New York-based clients that were, you see it in the news. It was a worse than a Greek tragedy going on in New York. And the inspiration for contact tracing actually came from just a call to a client to say, "Hey, how are you doing?" And they were like, this is our worst nightmare. And then I was like, well, what are some of the things? Just like, I've been in the office from 7 a.m. till 1 a.m. just pulling people off of schedules and trying to figure out everywhere they've been.
Right.
And I was like, oh, aha. Like this was like March 18th, this conversation happened, or maybe March 15th of last year. And so that led to 2 calls. And then our engineering team was like, yeah, that's something we can easily deploy and roll out. And again, like I said, it wasn't called contact tracing at first because that wording wasn't even really popularized yet.
Right.
So it was we were able to virtual care, same thing. So speaking and listening to our customers, and no one said, "Hey, can you give us a report that does this?" They told us their problem, and we listened, and that led to a solution that has changed the game for them.
I think that's tremendous. I think that's absolutely tremendous when you have a company like AlayaCare that you're responsive to the client's direct needs. They're the ones out there doing the work, doing the day-to-day, and you guys aren't just saying, well, this is what's needed, this isn't what's needed. You're getting that feedback from them, which makes their jobs easier, and you guys, take care of it for them. I think that is tremendous. What would you say is the one thing you would like to see AlayaCare offer, or that you guys are planning on offering, that you would like to see implemented that you haven't yet been able to do?
Well, that's I don't know if any of our competitors are on the call, so I don't want to tip my hand too much. Right. But I will say this. So I will, and it's a bias because it's one of my responsibilities. I'm a big fan of. It's where I started my career 20 years ago in the partner ecosystems of enterprise software applications. I saw companies like Salesforce and others grow up with it. So I will, with the exception of giving away too much from our product team, I will focus on my area, which is I would love to see our partner ecosystem really develop into something huge. Right now, it's fantastic. We've got amazing partners, good adoption. I'd love to see it be at the level where it's like plug and play, click and start up, where you can say, I want this applicant tracking solution or learning management system, 2 clicks, boom, it's in your system and it's working. That's a dream I personally have. That's not going to make or break anything for our bottom line. It's not, partner ecosystem isn't that big from a financial perspective, but I think from a client perspective, it's a big area for the nuances of each of those different agencies I spoke about before, that you can get such a big range. You can really build out best practices for your organization through partners on top of our product. Now, I also have a half a dozen items that I would list. Sure. But I don't.
That's fine.
I don't want to telegraph too much where we're going.
Right. And I'm not looking for secret sauce. I'm just thinking in generalize, kind of the industry, whether it's through the application or just through the home health care, hospice, home care field. What would you like to see implemented just overall, just for the quality?
I think globally, especially in the US, and there's a big Forbes article that came out today about it. I think interconnectivity of health data. Google's taken a stab at it and failed. Others have taken stabs at it and have struggled. There's a lot of walls up between a lot of systems. We've built our system to be highly interconnected. I think that's from beyond just AlayaCare and our individual clients, but I think of the industry as a whole. The more ability we have to interconnect the marketplace, acute through all the areas of post-acute, I think that is a game changer, like a societal game changer. I think that's really important.
Yeah, I couldn't agree more. I 100%. Last question for you. You were saying you get feedback from your clients, and that's kind of how the contact tracing before it became contact tracing came about. Do you ever get any feedback from your clients that they get from families about stuff that they would like to see? Like, you rolled out this family portal. What are some of the things they ask about?
So we actually, amazing question. And it's a little known fact because it was so long ago, but for Family Portal, we actually had a focus group where we brought families in from a client, and a variety of families, from pediatric clients and their challenges to, disability clients. So like a 22-year-old who is paralyzed, but has, full faculties, to, the son-in-law or daughter-in-law of a dementia patient. So we brought in all sort of different stakeholders and had a number of focus group sessions around it. And so absolutely. And then on top of that, we've just taken tons of feedback from our clients. I think the biggest, I'll go back to it again, is I think visibility more than even the ability to request, just having some visibility was a really important thing. Is like the real-time awareness and the real-time visibility into our requests, saying, hey, if I'm asking for a schedule change, what's going on. If you spend time, and I've spent time in the offices of our clients, they get a lot of phone calls with half information, asking for full information back. Here's my mom's name, and I want all, what's going on with her, and where's her invoice at, and what's her chart look like, and et cetera, et cetera. I think that, recognizing that goes a long way in trying to create value. I don't know if I explained it well.
Yeah, no, I think you explained it perfectly well. And I think also when, just giving those families and, your business owners a voice, I think speaks volumes to the level of attention AlayaCare gives to their customers, which I think, not a lot of people probably could say that. And I think that is one thing I would say just from this interview that really sets you guys apart, and I give you major kudos for that. I think that's fantastic, Neil. And I'm sure that originates from somewhere, because a lot of people don't go into it with that perspective.
No, it was very important from day one for our company to have that approach from not just me, the whole co-founding crew and all of the early team members. I mean, connecting to the clients themselves is important. The user conference is a great example of that. We did a user conference probably 2 years earlier than most software companies would do their first user conference. But we were like, we need to spend time with our customers in a centralized place as much as we can. And let's get them in a room and let's talk to them at their level. That mixed with a lot of client visits. I think those are all really important aspects. And that you're right in saying that from a culture perspective, I don't have the ability anymore, sadly, to go to every single client go live and spend time there. We've got lots of clients, but the teams that are leading the teams that are doing that, they were at those first go lives and saw, Brady, our VP sales, I mentioned before, he was sitting on a phone line as the helpline for all the care workers on that first day. He was taking a shift, help supporting our client's IT department, because he just said, it's all hands on deck. Let's get in there. And it's amazing when you see that. It's very hard not to replicate that culture and build that up in our entire company has a client first culture.
And I think that carries on to the people below you guys. And I think that's important. Yeah, Neil, I want to thank you for your time today. It was great to meet you. Great to learn more about AlayaCare. It's a fantastic company. And we really appreciate you being here on All Home Care Matters.
Lance, you too. It was a real joy and treat to chat with you today.
Thank you for joining us today at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate these long-term care issues. Please visit us at our website at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the podcast on any of your favorite podcast streaming platforms and watch our show on our YouTube channel. And remember to hit that subscribe button. Please be here next time as we welcome Paul Verhoeven of Mission Care as he discusses why Americans are still confused about home health care. Thank you so much.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.